My name is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Hello, and welcome to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today we are thrilled to have CEO and co-founder of Milu Health, Sasha Gribov. Sasha, welcome to the podcast.
What's up, Norm? It's great to see you.
Great to see you. So for all of our listeners and viewers that don't know Sasha, we'd love to be able to introduce Sasha, who's CEO and co-founder of Milu Health. Milu is revolutionizing healthcare with a platform that leverages electronic health record data and AI to help employees save money and access top-tier care. Recently, Sasha and his co-founder secured $4.8 million in seed funding led by A16Z, a testament to their innovative approach and potential impact. Earlier in Sasha's career, he was, in the venture capital world, was a management consultant at Bain, then holding key leadership roles as the general manager of Tempest's AI diagnostics at Tempest Labs, and was the chief of staff at Groupon before joining Tempest. So really excited to talk about your career journey and what you're doing now to really improve access and lower cost for patients.
I love it.
I don't know if our viewers know this. I think this is our first podcast guest, and I think by the time this is posted, you'll be 60, 65, somewhere in there, that I actually knew before joining the industry. Randomly ran into Sasha 2 years ago at Conference Board, if I'm not mistaken. And
That's right.
We put together that we went to the same elementary school. Sasha's a few years older than I, even though I have more gray hairs, and we went to the same elementary school and grew up in Cleveland together. So it's a blast from the past.
That was the best. I don't think I've run into anyone from elementary school in years and years. So that was awesome.
Sasha was like best friends with my first cousin Isaac. So it was like a very surreal experience to see someone you hadn't seen in probably 25, maybe 30 years.
Yeah, and
recognize. So it was cool.
Your family was like really special in our lives, because probably when I would have first met you, I was like 2 years off the boat, family coming from the Soviet Union. Like my parents didn't have American friends, so like getting invited over for like family holidays and hanging out, like it was a really special thing. So it was amazing to bring that back. It's a bunch of great memories.
Yeah, really, really great memories. And look at us now. We're, in the digital health world and making stuff happen. So it all worked out. So we ask everyone who joins the podcast, what inspired you to get into healthcare, especially after your time at Groupon?
I wanted to be in healthcare my whole career, literally just getting started in tech and startups. I always had this dream of doing something impactful in healthcare, because it always felt like the area where you could create something that hasn't been created, that would impact lives, that would make every single morning worthwhile, even if things aren't going your way. And like startups aren't supposed to work, right? 9 out of 10 startups fail. Like it's all hard. And not just tech startups, like anyone who's a healthcare broker, advisor out there running their own shop, anyone who's, an employer at a smaller employer, like it's all hard. But when you can work on a thing that can have a massive impact, it's worthwhile. So I always wanted to, and I could never quite find a way to do it. I'm not a doctor. Me and a close buddy have had a dream for, a decade and a half of building a new EHR. Like any health tech, literally probably every health tech founder out there dreams about, oh man, I could build a thing that's better than, the Epics of the world. And the reality is, like, we can't. There's a reason that every hospital in the country uses them. But I had that dream forever ago. And then it just so happened, I worked on a startup of my own maybe a decade ago or a little bit less than that. Didn't work out. I was traveling, had just gotten married. We got back to Chicago, and a bunch of the people that I had worked with before and loved and respected had started a company called Tempest that was doing something incredible in the oncology space, genomic testing for cancer patients. And I didn't know much about biology or cancer at all, but it was an opportunity to join up and be a part of something that could be impactful. So I did that. That was kind of my first real foray into healthcare. And then there, Gotham, my co-founder at Milu, we met each other, we worked together, And we became obsessed with this concept of healthcare costs, and specifically in the employer space, because at least we feel like employers absolutely get the short end of the stick, beyond patients who also get the short end of the stick, and doctors. There's so much that needs to be built for employers to actually manage costs, reduce costs, and do it in a way that's good for their employees. So we just became obsessed with that and had to go build a thing to try to do that.
I love it. Before we jump into what you're doing now, walk us through your time leading AI diagnostics at Tempest Labs. How did that prepare you for what you're doing now, and what was that experience like?
It was a great place. It's rare for there to be companies that are just full of incredible people who are all motivated by the same thing and rowing in the same direction, and that's what that was, which was awesome. And it was in a space where, in the next, if you think about what's going to happen in the next decade or two, what are the big areas? Obviously AI and self-driving cars and, I don't know, rockets, maybe to Mars, like really cool stuff. Genomics and biology is another big one. Yeah. Like we are learning stuff every single day. The number of papers being published on a weekly and monthly basis identifying new targets for cancer therapies is astounding. And there's a lot that can be done with that. So it was amazing to be at a place where kind of the best and the brightest were solely focused on taking the newest tech and applying it to do something for oncologists and for cancer patients.
And what were your greatest learnings over at Tempest?
That healthcare is hard.
Yeah. That's usually someone's first job in healthcare. They figure
it is. It is. But it's easier than it was in the past. We talk about this with Julie and Daisy, who are our partners at Andreessen, but they see a lot of stuff. And Julie was a former founder and product leader. Yeah. And so she's got great stories about the early days of EHR integrations and when you just couldn't do anything. And you could say the same thing across the healthcare spectrum. Like in our space, look at data, right? Your average self-funded employer did not have access to their own claims data, I don't know, half a decade ago. Yeah. I was just speaking recently with one massive self-funded employer that still doesn't. That's a big undertaking for them to go and work with carriers and pull that in and make sense of it. And so when you don't have data, there's just less that you can do. And so you see that in the employer space, you see that in the diagnostic space, you see that in the life sciences space, you see that in the provider space. I have a close friend who started a company that does AI scribing. They work specifically for therapists and mental health professionals. But, the minute they introduced that product feature, doctors and therapists just came flocking to them because there's just this need. Like it was just this untapped thing and it didn't exist before and now it exists and it takes off. And I think there's a lot of that in healthcare that just hasn't happened yet, that we're now getting the building blocks for it.
I'm excited to see a lot of those start to pop off. Should be super exciting. What were your greatest successes that you're most proud of over at Tempest?
We built things that didn't exist before, which was really impactful. And we were able to bring technology to both oncologists and life sciences companies where they didn't have access to some of that stuff before. And that's a really cool and meaningful thing.
Yeah, absolutely. So you already mentioned you had, like, for 15 years, potentially longer, the aspiration to, put Epic out of business and put Judy Faulkner out, and, she could do philanthropy work the rest of her life. But, eventually, like, what inspired you and led you to co-found Milu?
By the way, I think Epic is, if you think about the companies that are going to be around, yeah, when you and I are retiring, them, NVIDIA, Microsoft.
I would agree. I said it tongue in cheek.
For sure. But it's funny because some years ago, like, all health tech founders would be talking about Epic this, Epic that. But when you talk to doctors, like that's one of the things about healthcare. You talk to doctors, especially you talk to doctors on different EMR systems. They're asking for Epic. Like Epic makes their life easier. And that's kind of what you aspire to. Like you want to be the thing that people are talking about, whether it's in our world, it's benefits leaders and brokers. Like that's the gold star.
For sure.
All that said, I lost the actual original question that you asked.
So what inspired you to start Milu specifically?
If you look at the employer space, nothing has come around in a meaningful way that reduces cost without changing the plan or increasing deductibles in a way that's easy to use for patients. So like now that we're in this space, I see a whole bunch of stuff that works, but it all comes with trade-offs. And those are trade-offs that employers need to make and brokers and advisors need to make around, hey, I'm going to move off of a Blue Cross or United network and I'm going to be able to save 30% by doing that. But I'm also going to get some pushback from my employees and their dependents. Or I'm going to raise the deductible, or I'm going to do X, Y, Z. But there's a lot that you can do within the construct of the plan, especially if you have like a thoughtfully designed plan that can have an impact. And so as we got around to looking at that, we said like somebody needs to build a thing that can do that. And you need two puzzle pieces. You need data and you need employees to actually engage and care. Solving either one of those without the other means you've done absolutely nothing.
And it's
right?
very difficult to solve either, let alone both.
Exactly. So we said, let's go spend the next 10 years of our lives beating our heads against the wall to try to do that. And I think we have. There's, another decade of us proving it out and building it and growing it. But that's why we started it. We just saw a problem that hadn't been solved, an absolute massive need, and a way to do it. And so when you do that, you can't sleep at night for a few nights because you're dreaming about it and, staying up half the night talking to your co-founder and business partner about it, then you kind of go and do it.
I love that. So walk me through the mission at Milu and exactly like what are you doing that is completely different than what else has been seen in the market? And I also would ask like what's the most similar thing in the market and why is this significantly different?
For sure. We do three really basic things. Number one is we ask employees to connect their health records to Milu. Employees don't have to do that. They can ignore us. They can skip it. We'll still help them if they don't. We can also work off of claims data. We do also work off of claims data. But we've spent a few years building out the technology to connect to electronic health records. And so number one, we ask employees, hey, Milu can do all this great stuff for you. We can help you fight bills. We can help you find ways to save money on drugs. We can recommend great doctors. We can find great benefits that are part of your plan. We can help you with financial aid. We can see if you have a gap in care that nobody's told you about, which by the way happens and is crazy. But to do that stuff, we need you to connect your record. And then we'll get you a nurse on our team who's going to go and help you. So number one, connect your record.
And real quick, your company can't dictate that they must do that. But
Correct.
Can their employer, can they heavily incentivize? Can they create certain incentives to make sure that a huge percentage do? Like what are kind of the ways that you can get a large percentage of the population to opt in?
You can do it in two ways. One is incentives and two, make it easy. And so we've solved the make it easy part. The incentives, it's kind of left up to the employer and, we'll partner with the employer on doing that. I don't actually know if somebody wanted to force it. I don't know if you could. I don't think so. I don't think we'd want to delve into that space because you don't need to, right? Like at the end of the day, it's mine and yours and a patient's private data. And if they want to keep it to themselves, that's perfectly fine. What we see in our world is the minute that you can help someone, 99 out of 100 folks are like, great, please do that. I'm happy to connect my record. I'm happy to have someone go and look at this for me because my healthcare system isn't. So, outside of like the doctor's appointment that I'm at. So please help me. So then back to what do we do?
How do you make it so easy? And sorry for cutting you off.
No.
Two main things you do, but how do you make it so easy so that it is really turnkey? Frictionless.
So we've spent a while trying to perfect this. We actually now just got it to a point where an employee can just press a yes button to authorize us, and we're able to go and connect to their records, which is amazing. Other connections that we've set up in the past were harder, and now we've gotten it to a point where it just works. Now, it doesn't always pull from every single record, like that doesn't exist in the world, but any major healthcare system, any major specialist center, where most urgent cares, we're able to go get. The only stuff we really miss is like if you go to a chiropractor or a podiatrist or a psychiatrist that's on paper records, like some stuff is missing from the system, but the majority of stuff flows through it.
Awesome. So talk to us about 2 and 3 in terms of functionality.
Yes. So number one, connect to a patient's information when they authorize it. Number two, identify ways to help them and personalize that to the plan. And this is where AI is absolutely huge. It's one thing if, Norm, an employee at one of our companies, connects his record. It's another thing if we then say, okay, great, the plan that Norm's on is a Cigna PPO wrap network with these 5 other point solutions. Norm's got Hinge Health and an imaging solution and a center of excellence. And then we're able to knock those against Norm's data and say, hey, when are you a fit for one of these things at the time that it matters most? Like that's the key part. And then the third part is communicating it. So like if you can't actually tell the person that we've got a way to help you and do it in a way that they're actually going to read and respond to, none of it matters. And so we go and we solve the third part too, which is a very fancy way of sending. We send people saying we send people smart text messages again after they've registered and authorized us, but like people read that and they respond. And we do it smartly. Like we don't spam people. And when you register, we send an intro text so that you have the number saved and you open up your phone and you see our stuff before. And we'll send you a TikTok like video, basic stuff that just doesn't exist there.
That's great. And functionality number 3?
I skipped ahead. Functionality number 3 is the actual communication. Number 2 is matching it up to the plan and running an AI system in the back end that says like, here's the thing for this member right now. Yeah. And then number 3 is actually go and communicate it.
So walk me through the patient journey. Like patient starts at a new employer that's covered by Milu. Say one click of a button, they offer up their health records for you to be able to analyze. Like walk us through like just a patient journey where they have some issues, Milu comes in, they see where there's some gaps, they fill those gaps, they guide the patient towards more affordable but also quality care. And like walk us through a scenario where you're like, hey, like we built Milu for this exact like scenario.
By the way, you can pronounce it any way you want. We named it a thing that's impossible to pronounce, so everybody in the world has the right to pronounce it any way they want to.
I'll stick with Milu, sorry.
No. So for the first part of that, it's literally the world's easiest process. Like you're an employee, you get a basic welcome email from your employer about your benefits and from us introducing Milu. You register, it takes about 22 seconds. We've timed it. And you basically agree to terms and say you're fine sharing healthcare data and want to sign up for Milu, and then that's it. Then we send you a text message. And then you forget about us. Like that's purposeful. We don't want you to go and download another app. We don't want to be the like third app that you have to download for your healthcare plan. And we don't spam you with a whole bunch of stuff. But we're monitoring in the background. And whenever there's something going on in your healthcare journey, and by the way, you can invite or add dependents, etc. And then whenever there's something going on in your healthcare journey where there's a way that we could help, we go and reach out, and that's it. So basically you sign up and then you get a text message. And then that text message is about any of the ways that in the healthcare system, a member could be helped. So, you had asked earlier, like, what exists like this? Like, who are you like? Who are your competitors? The way I think about it, there's a lot of navigators out there, and there's a lot of really good navigators, like companies that have been built in the past 10 years that do an awesome job. Nobody is out there proactively pinging patients whenever there's a way to help. Like the only thing like this that exists is kind of in the Medicare space where there's incentives for people to keep their patients healthier, whether it's a healthcare system that's gone, at risk or one of these companies like Oak Street Health. But like, that's the system where this exists, where somebody is covering the cost of the patient's care. And so they're monitoring and looking out and reaching out. We're trying to bring that into the employer space. And that just doesn't exist in the employer space today.
Understood. So how does Milu engage patients through their healthcare journey to have them save money? Not only for themselves, but also for their employer.
We do a bunch of stuff. And the way we think about it is there's no world, or pretty much no world, in which you're saving money for the employer if the employee isn't participating. There's all kinds of plan changes you can be making, tons of stuff you can do. That doesn't really involve us. That involves stuff that you should be doing in a meaningful way with your broker and advisor. Mm-hmm. But for us, like if the employee isn't engaged and taking an action, the employer's not going to save money. So the incentives are actually nicely aligned. So I can give you an example. One of the things that we do is look for financial aid opportunities for folks. And this is a game changer for blue collar workforces where you have someone who's working on a production line making, $30 an hour, $22 an hour, whatever it might be. Pretty much no one knows this, but all of those folks are going to be eligible for financial aid at their local hospital if they have a big bill. And it's like the thing that's taped up on the wall in the bathroom, whatever. Nobody actually goes through the process, but the hospital has to have it to maintain their nonprofit status. So one of the things that we do is just run that check. If we're working with a blue collar employer, we'll ask them to give us a sense for who are the employees that are likely eligible. You could do that with salary data. You could do it with job title, salary bands. We don't need to know to a penny what someone's making. But if we see that, hey, Norm's an employee at, manufacturing company X, he's a shift supervisor, and he just had an emergency room overnight admission, that flags in our system, and we go and we reach out and we say, hey, Norm, just so you know, you might be eligible for financial aid at, Hospital X. Let us know if you want our help with that. And it's our AI system catches that, and then we have a nurse that actually reaches out and helps. We just had one this morning where someone exactly in that boat, we're saving them $4K. And this is someone who's
great,
does
really
not have
awesome feeling, I'm sure, for you and your team.
Yeah, it's really cool. It was funny. This is the inside Milu's Slack channel, our billing nurse who was looking at it was like, oh my God, this is an opportunity to save $24K for someone, and was super excited. And then as she dug into it, it was only $4K. She was bummed. We're like, are you kidding me? This person does not have $4K saved to pay for this thing. It is life-changing. Doesn't matter if it's $24K or $4K. That's a life-changing thing. So that's one example. Now that one doesn't actually save money for the employer. We're super upfront about this stuff. When we help people with financial aid, that saves money for the employee. The employer is still typically getting billed. Oftentimes their future care at that hospital for the rest of the year is covered, so that it could actually save the employer a lot of money, but we don't promise that. But that person's engaged. They know about us. We changed their life. And when a month later we see that they're being referred to an orthopedic surgeon, they're going to respond to the text. They're going to look at the recommendation that we're making.
Yeah.
When we ping them and say, listen, you're on Humira, and even though you have a coupon card and it doesn't cost you all that much, there's a biosimilar that does the same thing. And, next year it'll save you a bunch when you have to hit your deductible again. And by the way, it's going to save your employer tens of thousands of dollars potentially. People respond and they're willing to go and look at that.
That's really, really awesome. How do you guide patients towards high quality doctors that also are cost effective? How do you use data, use AI to identify which doctors are the best bang for their buck?
It's funny. There's a few ground rules in any of that stuff. Number one is nobody wants to go to the cheapest doctor. When we first started the company, before we had a product, we just had some designs and we were doing some user research and we'd show some stuff to people and we were like, okay, Dr. X, your appointment's going to cost $500. Dr. Y, your appointment's going to cost $75. How would you go through this? And everybody picked not everybody, but a lot of people picked the expensive one because they're like, yeah, that's the good one. That's my quality metric.
There's no correlation between cost and quality in healthcare.
Exactly. But nobody wants to go to the cheap doctor. So that's a great thing to know. And so everything that we've designed is around, let's show people the highest quality clinicians for the thing that they have to the best of our ability. There's some things where you could do a pretty good job of that based on the data that's out there. For a surgeon, you could look at who does the most of this kind of surgery and how do their complication rates and readmission rates and, depending on the condition, mortality rates compare to, others in their area who see similar risk patients. You can do that. If you're recommending an oncologist for someone, you can't. Or if you're recommending a PCP or a pediatrician, for a pediatrician, complication rates or readmission rates are you're going to be looking at that's meaningful. And so in that case, you go and you look at other stuff. Do they follow guidelines and what are the reviews like, etc. So here's what we do. Number one is we work with the plan to figure out, within the plan, what are the options. Some plans will have tiered systems, etc. So we'll bring all of that in so that we're actually guiding people based on what exists. Some plans will have direct contract. Then we work with a few third parties who go and aggregate hundreds of millions of claims worth of data or data worth of claims, and go and build quality metrics based on outcomes. And so we pull that in and we do that from multiple sources so that we're not just reliant on one. And then the last thing that we'll do is we'll look at cost. By the way, you save the most money by finding a high quality clinician for someone.
Yep.
you save way more by doing that than you do by saving on the actual procedure.
Downstream costs are way
Exactly
more than a few $1,000s here and there on the actual service itself.
Exactly. But especially if we're working with a plan where employees have significant out-of-pocket costs, they want to know, and they want to go to a place that's going to be more reasonably priced. And so we'll pull that in as well. And we're not, we purposefully haven't built a system that says like, hey, if you go here, it's going to be $122. If you go there, it's going to be $152, because no one actually knows. It all depends on the billing code, and the billing code is going to completely vary based on what's in the note, the doctor, the coder, the system, the AI that the hospital is using, all that kind of stuff. So no one can actually accurately predict that unless it's like a small exception. But we can tell you, hey, if you go and get a hip replacement at the major academic center in town versus at an outpatient surgery center, there's going to be significant cost differences. And so we focus on that stuff.
Great. How does your company flag and fight incorrect medical bills, not only for the employer, but also the employee?
So most folks in the healthcare space kind of have seen the stats, half of bills have some kind of error, et cetera. And it's true. We look at a lot of bills, and a lot of them are messed up. By the way, sometimes by the provider, sometimes by the insurer, sometimes by a third-party middleman in between. It's a mess. So we look for a few things. Number one is we'll go and we'll scan. If someone connects their health record to us and we have access to the claims, you can match the two up and you can see, is there something that doesn't fit here? So we'll go and do that. The other thing that we'll do is we'll look for large bills and see, is there something that seems incorrect? And then the last piece is members can also reach out to us, and it's as simple as snapping a picture of a bill and shooting it to us. And we'll go and we'll dig in, and we're insanely upfront with members saying, you don't know if we're going to be able to save you something. Sometimes there is an error, and ultimately, like, the hospital is just going to say, we're right, you're wrong, and deal with it. The hospital, by the way, might also say, but, if you're willing to pay it in the next week, then we'll give a 30% discount. And the average patient doesn't know that. So we dig in and we do that stuff. We're not like a bill auditing vendor. Like, there's a lot of companies out there that just do that. We strictly do it from the perspective of help a member, engage a member, and see if we can identify something that's big.
Yep. Milu has integrated EHR data from over 40,000 provider groups and health systems. What was the biggest surprise that you can share of taking that amount of data, synthesizing it, and getting like actionable data? What was the biggest surprise you and your co-founders found?
So, when we got started, there's a law that was passed, the 21st Century Cures Act, that says every patient in the country has the right to go and get their EHR data if they want. And every electronic health record vendor had to comply with that law and had to make open APIs and make stuff available. I didn't expect that everyone would comply, but it's just kind of a little wacky when you get into it and you just see there's like a few, EHR systems out there that just don't comply with a thing. Like, they just don't do it. Which stinks. And by the way, all the big ones do, like Epic and Cerner and Allscripts and Athena, like they all do a great job. And it makes it really easy to pull down the data. But there's some others that just don't.
There's a few bad apples.
Yeah. So that was a little bit wacky. The other one that's fascinating is when you show people their EHR data, there's stuff they have no idea about. We were working with one patient who didn't know that they were being called a diabetic. Like, what? Like, what do you tell? Or maybe it was a pre-diabetic. It would be kind of crazy if it was diabetic, but like, no idea. No one had ever talked about it with them. But it was in their note, like, hey, this person is at, very high risk. They're going down this path. So that was another one. And then the last piece is like how rich the data is for being able to have an impact. Like that's why we're so convinced that we've built the mousetrap that's going to be a game changer for employers. Like, you can see future scheduled appointments. Like, you go into my chart, you see that I've got a physical scheduled in 7 months. You see that I've got a specialist, that I asked about seeing. Mm-hmm. In the old world, you'd kind of rely on a claim that would come in 3 months after the fact if you had access to your claims data and the person had already picked their doctor and yada, yada, yada. And we can start to get ahead of that stuff now.
That's great. You recently raised nearly $5 million from A16Z, one of the top venture capital firms in the world, especially during not an easy time to raise money. What advice would you give founders who are going to raise, a seed round in 2024 into 2025?
We raised the round a little while back, right when we started the company. So I think we actually got super lucky. Like we raised before the tech world went completely off a cliff, before Silicon Valley Bank and all that kind of stuff. I think a lot of that has also rebounded now. Like it would have been way harder to go and start a company a year and a half ago, or probably even a year ago versus now. At the end of the day, if you have a thing that you think will work, you'll be able to go and get it started. And if it's harder to raise than it should be, ultimately, like, it'll be better for the company. You're going to run the company more leanly. You'll figure out ways to work around it. Like the companies that should be funded will find a way to get off the ground and get running.
Fantastic. What are the, patients and customers of Milu saying about the service? Like, what is the customer feedback and patient feedback you're getting? And how does that keep you and your team just motivated to keep going and keep building?
It's awesome. Like the employer space is hard. If you talk to large employers out there today, they'll say like, I've brought on so many point solutions. I don't want more. My employees don't engage. It's hard. We're not going to go doing more stuff. And so like, it's a mountain to climb if you're starting a company in the space, and it should be. The flip side is we get to hear from our customers how much of an impact we're having, both on their employees and on their cost basis. And then from their employees, like we recently talked to a bunch of folks who we helped over the past year, and like they had tears in their eyes. Like there was a woman who had a cancer diagnosis. She got a call from our nurse on her drive back from the oncologist's office because like it came through her record and we saw it and we reached out. Like her husband was talking to us crying about it. We have an HR leader at one of our employers who's been like reaching out for like, folks that aren't at the company but are in the community and need help. And she's like, listen, I know like you're like technically, not contracted to do this, but like here are 3 people who are like stuck. Could you please help them with a bill or with finding a great doctor? And we're like, yeah, of course. Like it's the right thing to do. And ultimately we've kind of built this mousetrap that aggregates all this stuff, right? Like we make it's really easy for us to find if someone can save money on a medication. We have access to data on who are top doctors, which no patient in the country, unless you have like one of like 2 or 3 solutions from your employer, like no one has access to this stuff. So if we have a chance to go and help someone with it, like we love the chance to do that. And that keeps us going. Like we have a little Slack channel called Wins, where like anytime like we're able to help someone, it gets in there and it's amazing stuff.
I think you should post it on LinkedIn or social media every time, as long as we're not sharing any like.
Yeah.
We gotta, abide by HIPAA. But I think like that's the type of thing that really motivates people and gets people excited about joining a mission. I would highly advocate it if you're trying to attract the top talent, without a doubt. So when I saw you for the first time in 25 years out in San Diego a couple years ago, and you told me about the concept of the company, I immediately loved it. And what I liked most about it is you're reaching out when a patient needs it, like at the exact moment. And on top of it, I do think because your solution is very like patient focused, you do enable benefits teams to allow their patients to get reminded of things they already have invested in and they already, purchased maybe months, maybe years ago. And you're potentially, in a lot of cases, helping other vendors get better engagement on their apps that already were, sunk costs, for the employer. Can you kind of walk us through like any data or any examples of in real time Milu reminding a patient, hey, you have access to these, benefits or these services that's really helped some of the employees at your customers?
Yeah, 100%. We see that a lot with imaging. Like we see someone has an MRI come up or they need to get one. And like any day, there are so many ways to save for a patient a few $100s up to a few $1,000s on getting imaging done. Sometimes they'll have a great benefit as a part of their healthcare plan to do that. Sometimes it's just within the
That's
Blue
a
Cross
newer
plan.
thing. Like One Imaging's the only company I know of that does that. But like prior to them coming into the market, it was kind of like good luck. Like,
Yeah, there's another one called Green Imaging that a bunch of our clients have. Like, but that stuff is so needed. And then if you don't have one of those benefits, you can also save money just on your own, like within your Blue Cross or United or your Aetna plan by going to an independent center. So that's just like the lowest of all low-hanging fruit. Lab tests are another one. Like if you get lab testing done at a large hospital, it's going to be 3 or 4 times more expensive than if you go and do it at like a national lab. You drive up to like a Quest or LabCorp. So we see that stuff a lot. Surgeries are of course like the big ones, and there it's not just about saving money. It's about finding a really high quality surgeon for someone who's A, done a lot of the thing, and also B, isn't going to go and do surgery unnecessarily. Like they're conservative in their approach, or they're appropriately conservative. So we see those pieces all the time. And then on the engaging with benefits, we ran a pilot with one of our groups, working with a chunk of their employee base, not touching another chunk of their employee base, just to see what the difference. We saw a 350% increase in folks using a center of excellence benefit.
wow.
3.5x higher. I was expecting a 30% increase, a 50%. Like I would have been ecstatic with any of those. And like small numbers, pilot, yada, 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 but like 350%. It was crazy. And that was for folks to use a center of excellence benefit where they're flown out for a direct contracted surgery at a top
I have
place.
a client, Karam, that does that, and they do an insanely great job.
Yeah.
I know people have used it and love it.
It's like the best benefit out there. The employee doesn't have to do it. It's up to them. It's amazing. But most people don't know about it, right? Like they're told about it during open enrollment. That's about it. Like the percentage of people who could use it versus who use it is a fraction, and it can be way higher. So that was a really big one. And then we increased utilization. That same client had a provider quality program on their plan. It was like if you go to top tier doctors, it wasn't through us. It was through another group that does an amazing job. You go to top doctors and it's free for you up to a certain limit. So another amazing benefit. We increased utilization of that by 400%. Just by seeing, hey, this is someone who likely has a need for a specialist. Let's go and tell them about it when that's popping up so they know they have this program.
For all of our benefits friends that like run benefits at a big or small corporation, like literally all the things you've already purchased, already implemented, if you put Milu in, it's going to increase utilization of everything you've already invested in. So I don't see a reason not to give Sasha and team a shot. I guess my question is like, Sasha, what is typically the pushback from benefits leaders, from benefits consultants, other than not another thing? Like, other than just like the point solution fatigue in general, what else is a logical pushback? I'm struggling to think of one.
No, I'll give you a good one. We're a little strange. Like we go in and we say, listen, hey employees, we can help you. But the horse trade is for us to be able to really help you, you provide access to your data. And obviously like we treat security and privacy like with the most care. We build all of our systems to follow the HIPAA regulations. Like we've done that from day -1. But there's some employers out there who say, listen, I want to have an arm's length relationship with healthcare. Like I'll buy a mental health solution and I'll buy a fertility solution and I'll buy a telemedicine solution. But like, I don't want to get in the weeds. I don't want to know, or I don't want other people to know that someone's got a surgery going on. And I get that. I totally get that. Like, we're not the solution for those folks. The other side of the spectrum is healthcare is my number 2 cost line item. And I could do the status quo, which is kind of outsource it and let it run its course and deal with my cost increases every single year. Or I can roll up my sleeves and get into the nitty gritty in an appropriate way and figure out ways I can be saving money. And like, that's what we do, right? We've built this system that is a new way of going in and saying, I'm actually going to manage the health of my population. We started calling it a population health management tool for employers because like there isn't one, but you got to want to do that. And it's not for everyone, but for the employers who do, I see us as like the first system that uses technology and AI to sit and identify stuff and then actually go and do something about it.
Yeah. Obviously, like someone's health is very dependent on social factors, there's a million factors. Well, let's take out like eating, exercise, environment, income, location, like all of the like stuff people have some control over. I would say when it comes to like, okay, healthcare and you have no control over these things, a lot of people think, well, someone's health journey and their, longevity and their, anything kind of in terms of life expectancy and quality of life. A lot of people think like the most important determining factor is like who's their primary care physician. I would argue in this age, like who their benefits manager is going to have a greater impact on what their healthcare journey is going to look like as opposed to who their PCP is. And I think that's like a very foreign concept to 99.9% of people, in the US that don't really look at the healthcare system all that closely.
Yeah, I mean, it's a crazy thing. Your PCP, especially if you have a great PCP, is so important. Like, you got to show up, you got to do it. But at least for my PCP, I come once a year, and if I want to schedule an appointment, they're scheduling 11 months out. Like, I can't get in. Maybe I can MyChart message them. I've had a few PCPs who, like, I wouldn't really hear back from. I have a PCP now who I do, which is amazing. But, like, they don't know me. They don't know what's going on outside of ordering lab testing once a year. And by the way, your benefits manager also doesn't. But your benefits manager has an opportunity to put a bunch of things into place that can really, really help you, especially for the 11 and a half months of the year when you're, like, not a week before or after the appointment. There's a lot of stuff there. And by the way, there's different approaches to this stuff. So we also run a podcast talking about healthcare stuff.
I follow it myself. I love it.
And we had an awesome benefits leader on it last week. She's the benefits leader at Costco. And she made the point that, like, they invest in stuff and they expect costs to go up. Like, they're not investing in stuff trying to see costs go down. They go and buy mental health benefit for their employees. They want to see their mental health costs go up as a result because they want people to use that stuff.
People are using it. Yeah,
exactly.
Meaning the downstream costs will decrease, but you have to invest at first. There's a couple solutions out there, a couple mentioned today during this episode that like do save money day one, and they improve quality. But let's say 95% of solutions out there in the healthcare market are an upfront cost and a long-term savings.
Exactly, and so. And by the way, a different company that's not the size of Costco and that doesn't have the long-term investment horizon and the luxury of doing that, like they're gonna take a different approach. Both are fine. Like both can really, really help their employees when done the right way. But it just, by the way, I'd also expect a lot of benefits leaders didn't go into their jobs expecting to have the weight of responsibility that they do, and it's not easy.
No, I empathize a ton because it's a lot of responsibility and they don't have many resources. They're a very under-resourced, department of companies in general. So, it's definitely a tough task that they have on their plate. What's next for Milu in the next 3 to 5 years? Like, what you do today is great, but like, what are you going to do over the next couple of years? Just get a little bit incrementally better every day, or do you have some long-term horizon projects that will just enhance the capabilities?
The biggest thing that we're focused on for the future is now that we've built the pipes into this data, which is a game changer, and now that we've gotten good at communicating with the employees, and by the way, we can continue to get way better there, and we will. How do we help them live longer and healthier lives? Like, how do we go and find stuff in the data that most of their PCPs don't because they see them once a year? And so what that actually means is care gaps and like find things. Can we become a system that sits in the background and sees stuff that's starting to happen with someone and can jump in and help out? I'll give you an example. We went live with an employer a little bit ago, sizable tech company with pretty well compensated employees. We had an employee that signed up, connected the record, and we saw that they were a diabetic who had recently had a baby and went to go see their endocrinologist and told them that they're not going to keep using their monitor and their pump because they can't afford it because they had a baby, they paid a lot out of pocket, and they don't have the money for it right now. And so that was and by the way, the doctor knew that. The doctor couldn't do anything about it. Like, the doctor doesn't run the health plan. but we're connected to the health plan. So like we can see that stuff, and like we can help them apply for a coupon code for their monitor. We can reach out to the benefits leader and see is there like anything there, because that's gonna be a big claim in a few years. Like,
oh yeah,
and so today we're doing that, but we're doing it in specific cases. And I think where we're gonna evolve into is a system that uses AI to catch that stuff, not in a big brother way. It always comes down, like if we catch that stuff, it's reaching out to an employee and saying, hey, we saw a thing, can we help? We had another one. Someone was prescribed a med and didn't know about it. They were prescribed a statin, which can be life-saving.
Yep.
For cardiac issues. And no one ever told them. Like the prescription was like entered into the notes, but not officially created. They never got a text message. No one ever called them. It was just like a ball was dropped, which happens. Like,
yeah,
happens every day, millions of times a day. It's a big healthcare system. But our system saw that a thing had happened, and we reached out to the patient, and they found out about it, and they got on the statin. Which is a big deal. So I see us investing more and more in that.
I love that. And my opinion, take it or leave it, but I think you'll like this one, is that the next 10 years, companies that thrive and companies that fail a huge determining factor will be engagement and adherence. Like unless you're able to engage patients where they are, when they need it, and then that push in the right direction allows them to adhere to their long-term plan set for them by clinicians, like you're going to have a really good success, or a chance of success. If you're not great at that, that's not a core competency of the company. I don't care how good everything else is, you're going to struggle. So like not only that you can allow and enable engagement, but also adherence, not only to your own platform, but every other platform the company is invested in. Like, I just don't see how this company won't continue to thrive and grow and just make a bigger and bigger impact year in, year out, because over the years, you'll get more and more customers, more and more lives, more and more responsibility, and great opportunity to, do great things for a lot of people. So really excited for that. I will ask you this. Everyone who comes on this podcast is from the healthcare industry. We live it, we breathe it, we sleep it. How do you practice what you preach? How in a very stressful job, backed by A16Z and, a lot of pressure, a lot of ambition, how do you stay mentally, strong, and how do you stay motivated and engaged in your own health journey when you're trying to help thousands, eventually millions, handle their health journey? But how do you lead from the front?
It's actually really easy for me. I have 3 young kids at home. So like I don't have a choice. Like I come home, like I'm on dad duty, and I want to be, and it's the best thing in the world. And like if I'm distracted, like they pull me away. They're like, "Dad, get off your phone."
Yeah.
So like they help ground me so much.
And just chasing them around is enough.
It's the best
activity to have in a given day.
It's literally, yes. My son's a first grader, and he's like super into every sport. So like we're just outside on the weekends, like tossing I've tossed a football more in the past 2 months than I have in my life combined.
Yeah.
And it's amazing. So, it's all a balance, and having my kids and my family in my life is like the most balancing and grounding thing ever. And it's amazing.
That's great. And then, I do think a huge determining factor of someone's health is what they put into their body. So any healthy recipes you and your family make at home that might inspire someone to try something new?
Well, my son and my middle daughter, who's a kindergarten, have gotten into just socking me in the belly and saying that's a little wobbly. So that's very good inspiration for.
So apparently, direct, honest communication is a big thing in your household.
It is, and there's nothing that grounds you more. I've also gotten pretty into, I think, just based on reading stuff on Twitter, like this perspective that we are putting a ton of shit into our bodies, sometimes knowingly, sometimes unknowingly, that we don't have know much about. My mom was diagnosed and died from gastric cancer like within 6 months 2 years ago.
Oh, so
thank you. But that was just one of those things that like gastric cancer is not like a thing in this country. Like it's pretty, I mean, it is a thing, but it's pretty rare. But if you look at the incidence of that and pancreatic cancer and any number of GI issues, it's all skyrocketing. And the same way that we learned, that smoking was bad and that like baby powder is bad, like we'll learn in a few decades what all this stuff is, and we're starting to learn now. So I'm trying to get ahead of it. I threw out my black spatulas last week and my nonstick pans. There's a limit to this stuff. Like I believe in vaccines. I always will. I believe in traditional medicine. But like we're just learning about stuff that is in the world of nutrition that sits outside of, in many cases, traditional medicine. So I don't know. I'm not a guru in this stuff. I don't actually know, but I think the more any of us can read about it and learn and figure out like what are the chemicals that are in stuff, and like can I spend a little bit more and get a thing that doesn't have it? I think that's a worthy trade-off.
Yeah, for all of our listeners and viewers, I think always the safest thing to do is if it looks like it does, like when it's grown, if it's plant-based and it is a whole food, chances are it's probably better for you than something that doesn't look, it grew in the ground or on a tree. So just easy fix to start before you make the deep dive into, anything super healthy related from a food standpoint. Well, Sasha, really appreciate your time. Really enjoyed the conversation and hearing all about what you and your co-founder and your team has done at Milu to help patients and employers. So thank you so much for joining us on the Digital Health Heavyweights podcast. And we're excited to see you and your company grow over the coming years. We'll have to have you back when you hit 1 million members.
Thanks, Norm. This is awesome. Take care.
Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.